Hello and welcome back to Zoology 141 Online. Today we're going to complete our lecture on the skeletal system, focusing specifically on the appendicular skeleton. So make sure that you've watched the lecture on the axial skeleton first before watching this lecture. In the appendicular skeleton are all the bones that are here shown in orange. And so the appendicular skeleton is appended to or tacked on to the axial skeleton. And the components of the appendicular skeleton include the upper and lower limbs, as well as the girdles that attach those to the axial skeleton. And so the functions of the appendicular skeleton, of course, include walking, as in the legs, and also lifting and carrying things. So the first girdle we're going to focus on is the pectoral girdle. The pectoral girdle attaches the bones of the upper limbs to the axial skeleton. And it consists of the scapula, which is seen below, and the clavicle, seen above. The clavicle is the only bone that articulates with the axial skeleton. Specifically, it articulates with the sternum and also the scapula. It's important to realize that the scapula itself is held in place really only by muscle. There's muscle on either side of the scapula, so that the scapula themselves are really suspended in a web of muscle and only have a very tenuous attachment anteriorly via the clavicles or collarbones. So if you remember back to the lecture on bones and bone tissue, we said that the scapula was an excellent example of a flat bone. That is, a bone that consists almost entirely of compact bone. To me, I can remember the scapula because it's flat like a spatula. In any case, the scapula is a very important bone as it indirectly connects the bones of the upper arm to the axial skeleton via the clavicle. The scapula is also a very complex bone as it has several processes and fossae. Although you won't be held responsible for these on the lecture exam, you will be required to know them for the lab practicum and lab quizzes. So we'll go ahead and go through these now. So one very important area of the scapula is the glenoid fossa. Located on the lateral aspect of the scapula, the glenoid fossa is a shallow cavity that articulates with the proximal part of the humerus to form the shoulder joint. Now let's take a look at the posterior view of the scapula. Most conspicuous is a bony ridge called the spine. The scapular spine is a site of muscle attachment, and it also becomes enlarged on its lateral aspect to form the acromion. The acromion articulates with the distal end of the clavicle to form the acromioclavicular joint. Above and below the scapular spine are two fossae or depressions, each of which houses a different muscle. Superior to the spine is the supraspinous fossa, which houses a muscle that is aptly named the supraspinatus. Inferior to the scapular spine is another depression, the infraspinous fossa, which houses the infraspinatus muscle. Now let's take a look at the anterior side of the scapula. On the anterior or front side of the scapula, we see a third cavity called the subscapular fossa. Can you guess what the name of the muscle is that resides here? That's right, it's the subscapularis. And finally, on the anterior-lateral aspect of the scapula, we see a finger-like process called the coracoid process. This process is an important attachment point for the biceps brachii muscle, which aids in the flexion of the elbow and forearm. The coracoid process can be palpated or felt through the skin by pressing on the area ventromedial to the acromion process. So in summary, two bones comprise the pectoral girdle: the scapula and the clavicle. Now we're going to move on to the bones of the upper limb, which is the arm. So each arm consists of 30 bones. In the upper arm, a single bone is found called the humerus. The humerus articulates proximally with a shallow socket of the scapula, which was called the glenoid fossa. Distally, the humerus articulates with the two bones of the lower arm. These bones are called the radius and ulna, and the radius and ulna articulate distally with the bones of the carpus. Now, in some anatomy textbooks, they'll refer to the upper arm as the brachium and the lower arm as the antebrachium. So be sure you remember these two terms. So the upper arm or brachium is comprised solely by the humerus. The humerus is a long bone and it articulates proximally with the scapula and distally with the radius and ulna. The proximal part of the humerus, called the head, articulates with the glenoid cavity of the scapula to make up the shoulder joint. Just below the head is a narrow constriction called the anatomical neck. Adjacent to the head are two rounded processes which are important sites of muscle attachment. These include the greater tubercle and lesser tubercle. In between these tubercles is a steep valley-like depression called the intertubercular sulcus, which houses a tendon for the biceps muscle. Now below the tubercles is a much narrower constriction called the surgical neck. Midway down the shaft of the humerus is a V-shaped rough patch called the deltoid tuberosity. This is a site of attachment for the deltoid muscle, which is used for abduction of the shoulder. Now let's take a look at the distal end of the humerus. Remember, the distal end of the humerus articulates with both the radius and the ulna via two rounded condyles. These condyles have specific names. The most rounded of these condyles is called the capitulum, and the capitulum articulates with the head of the radius, whereas the more oblique-shaped condyle is called the trochlea, and the trochlea articulates with the ulna. Now just superior and lateral to the trochlea and capitulum are the epicondyles. Remember that epi means on top, and so the epicondyles are located superior to the condyles, and they don't actually articulate with other bones. Instead, they're very important sites of muscle attachment. Finally, if we take a look at the posterior view of the humerus, we can see a fairly deep depression in its proximal end called the olecranon fossa. This fossa accepts the olecranon process of the ulna, which is the elbow, during the extension of the elbow, and it also prevents overextension of the elbow by limiting the movement of the olecranon process. Now that we've covered the bones of the brachium, we're going to go take a look at the antebrachium or forearm. The antebrachium is made up of two bones, the radius, shown in red, and the ulna, shown in blue. The radius and ulna are connected along their entire length by a flexible ligament called the interosseous membrane. This membrane allows rotation and movement of the two bones relative to one another. Now, of the two bones, the ulna has the closest or tightest articulation with the humerus. The trochlea of the humerus fits snugly into the trochlear notch of the ulna, forming a classic hinge joint. Superior to the trochlear notch is a conspicuous point of bone called the olecranon process. This process makes up the point of the elbow, which is otherwise known as the funny bone. And if you've ever hit the funny bone, you know that it's very painful, and this is because there's a nerve, the ulnar nerve, that runs very close to it. Now, one reason the olecranon process is important is that it is the point of the elbow, and it enters the olecranon fossa of the humerus during the extension of the elbow. And this prevents the elbow from being hyperextended and injured. The olecranon process is also the insertion point for the triceps brachii muscle, which aids in the extension of the elbow. Now let's take a look at the radius. The head of the radius is circular, much like the head of a nail, and you can use this to your advantage when memorizing the name of this bone. So if you're to give me this bone and I see that it has a circle in one end, I would think that's a circle, and what does a circle have? It has a radius, and so that's one way to remember this bone. So the circular head of the radius articulates with the capitulum of the humerus to form a very minor half of the elbow. Remember, the ulna and trochlea are the major connections of the elbow, whereas the capitulum and radius are the minor connections. So just inferior to the head of the radius is a conspicuous bump called the radial tuberosity. And so the radial tuberosity is the insertion site for the biceps brachii muscle, which helps for flexion of the elbow and forearm. Now let's take a look at the distal end of the radius and ulna. Here we can see that the roles of these two bones are reversed. The radius extends far beyond the ulna towards the carpal bones that form the wrist. And it's important to realize that the radius forms a much tighter connection with the wrist than the ulna does. And you can demonstrate this when you supinate or rotate the wrist. When you rotate or supinate the wrist, the radius goes with the wrist, whereas the ulna remains relatively stationary. So at the distalmost points of the radius and ulna, we see two styloid processes. Remember, styloid just means pointy, and these styloid processes are very important attachment sites for the ligaments of the wrist. So distal to the radius and ulna, of course, we have the hand and the wrist. The hand and the wrist are composed of three different bones. The carpal bones, of which there are 8, comprise the wrist bones. The metacarpals, of which there are 5, make up the palm of the hand. And of course the phalanges, of which there are 14, make up the thumb and the fingers. So I can tell you from experience that of all the bones in the body, students have the most difficult time being able to recognize and correctly name the bones of the wrist. There's 8 of them, they're small, and they tend to be hard to identify. Fortunately, we have a very good mnemonic device for helping you to remember the names of these bones. And that mnemonic device is, some lovers try positions that they can't handle. I apologize if I have offended your delicate sensibilities here, but this is a very distinctive and easy to memorize mnemonic device because each word in the mnemonic device stands for a different bone within the carpus or wrist. So let's take a look. The word some here is a stand-in for scaphoid. So some and scaphoid. Lovers corresponds to lunate, whereas tri corresponds to triquetrum. Remember that tri means 3, and so the triquetrum is a bone that touches 3 different bones. The next word is positions, and positions is a stand-in for pisiform. The pisiform is a bone that extends most anteriorly in the wrist. Please don't pronounce this pisiform. Okay, now let's take a look at that. We're going to start over again on our right-hand side, and so that stands in for trapezium, they stands in for trapezoid, cant stands in for capitate, and handle stands in for hamate. So some lovers try positions that they can't handle. So just by knowing this mnemonic device and where to start, you should be able to identify all 8 bones in the carpus. In addition, I suggest you memorize the shape of the scaphoid and the pisiform so you'll know some orientation. Another bone that's easy to memorize is the capitate. The capitate rests directly under the middle finger, and so if you're ever in traffic and cut me off and then give me the finger, I will then promptly decapitate you. So the capitate sits under the middle finger. So now that we've completed the bones of the brachium and antebrachium, we're going to move on to the bones of the pelvic girdle. The pelvic girdle attaches the bones of the lower limbs, which are the legs, to the axial skeleton. And it consists here of 2 coxal bones, which themselves are formed from the fusion of 3 different bones. And these include the ilium, the ischium, and the pubis. So the coxal bones are fused with the sacrum of the axial skeleton to form the pelvis. And this is a very tight connection of fibrous connective tissue. The pelvis also connects with the femurs of the left and right legs by deep ball and socket joints called the acetabula. So as we said in the last slide, the hip bone is in fact made up of 3 different bones, and these are the ilium, the pubis, and the ischium. The ilium is the largest and widest bone of the hip. When you place your hands on your hips, if you're mad at somebody, you are touching the iliac crest. Inferior to the iliac crest is the ASIS, or anterior superior iliac spine. As you might guess, this is an important site of muscle attachment. Between the iliac crest and the ASIS is a shallow bowl-like concavity called the iliac fossa. The ischium is the second most prominent bone of the pelvis, and it is also the part that you sit on. We'll get a better view of the ischium in the next slide. The pubis, on the other hand, is the anterior-most bone of the lower part of the hip, and it makes up a very minor contribution to the hip and pelvis. Together, the pubis and ischium unite to form a large hole called the obturator foramen. This foramen is almost entirely occluded by fibrous connective tissue membranes, though a few blood vessels and nerves do pass through. Now, some people have a really hard time memorizing the name of this foramen, and so just think, if you didn't know the name, who would you call? Well, if I didn't know the name of the foramen, I would call the obturator. Ha 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 ha. Okay, last but not least, before we move on to the next slide, I should point out the thing that's in the middle of the hip, and that is going to be the sacrum. Remember, the sacrum is not really part of the hip, but it was the last part of the axial skeleton, and it helps to connect the axial skeleton onto the appendicular skeleton via the sacroiliac joint. So together, the hip bones, consisting of the ilium, ischium, and pubis, and the sacrum, comprise the pelvis. So this slide just shows a different view of the hip. On the left-hand side of the screen, we can see a lateral view. Again, the ilium is the largest and the broadest of the bones that make up the hip. The large wing of the ilium is called the ala, which is also an important attachment site for many of the gluteal or butt muscles. On the inferior aspect of the ilium, we can see 2 spines, the posterior superior iliac spine and the posterior inferior iliac spine. Inferior to these processes, we see a large depression or concavity which forms the socket for the head of the femur. This socket is called the acetabulum. One way that I remember the name of the acetabulum is to think, what anatomical structures is it close to? Think about the posterior area of your body, and you'll get it. Below the acetabulum is the ischial tuberosity, which is the bone that we sit on and is consequently the strongest bone in the hip. The ischial tuberosities are also attachment sites for the hamstring muscles. On the right-hand side of the screen, you can see a medial view of the coxal bones, and the structure indicated there is the ischial spine. As you can probably guess, the ischial spine is also an attachment site for muscles, specifically the muscles of the pelvic floor. Now that we've talked about the anatomy of the hip and the pelvis, we're going to talk about some differences in anatomy between male and female pelvises. Remember, the pelvis were the three hip bones, the ischium, ilium, and pubis, together along with the sacrum, which was part of our axial skeleton. So male bones are generally larger and heavier than those of females, and the male's joint surfaces also tend to be larger. Now, muscle attachment points are more well defined in bones of a male than that of a female because of these larger muscles. In addition, a number of other anatomical differences exist between the pelvic girdles of females and males. These are primarily related to the need for a larger pelvic outlet for females to facilitate childbirth. For example, if you look at the angle between the pubic bones in males, it tends to be much less than 90 degrees, so it's very narrow. On the other hand, if you take a look at the same angle in females, it tends to be obtuse, or greater than 90 degrees. The other thing you can take a look at is the pelvic brim. The pelvic brim is just the cavity inside the iliac bones. So in males we have a slightly heart-shaped pelvic brim, whereas in females we have a more circular or ovoid pelvic brim. And again, these differences in anatomy allow females to more easily pass a child through the birth canal. So I know that we still have to talk about the tibia, the fibula, and also the ankle and foot bones, but let's step back for a minute and talk about a comparison between the pectoral girdle and the pelvic girdle. The pectoral girdle does not directly articulate with the vertebral column. The only articulation we have is between the scapula, which is touching the clavicle, which is finally touching the sternum. So it's a very tenuous connection. On the other hand, in the pelvic girdle, we have a much more direct and concrete connection between the axial and appendicular skeleton. The hip bones, the cocci, connect directly with the sacrum to form the sacroiliac joint. And this is a very tight joint held together by fibrous connective tissue. So the weight of the skeleton is well grounded onto the hip bones. And this is important because the pelvis is bearing the majority of the weight in the body. In addition, the pectoral girdle sockets are much shallower than that of the pelvic girdle. So remember, the pectoral girdle sockets were the glenoid cavities of the scapula. And although these are rounded out with a little bit more cartilage, they tend to be very shallow cavities that allow a very wide range of motion. So think about all the movements you can do with your arms and shoulders. You can spin them into circles, you can swing them around, you can circumduct them. The range of motion is phenomenal. Now let's take a look at the range of motion in the hip. It's still pretty good. You can circumduct your hip. You can also abduct and adduct your hip. But for most of us, we can't move it in near the range of motion that we can in the pectoral girdle. Now, on the other hand, let's think about the propensity for dislocation. Have you ever heard about somebody with a dislocated shoulder? Well, probably have. Because the glenoid fossa is so shallow, it's very easy for the head of the humerus to luxate out of position and therefore result in displacement of the shoulder. On the other hand, the hip joint is a much more solid and deeper joint. Remember, the part of the hip that articulates with the femur is called the acetabulum, and the acetabulum is a very deep concave depression that fits very tightly around the head of the femur. And although it does allow, again, pretty good range of motion, it tends to be a much tighter fit and have many more ligaments around it that help to prevent the femur from luxating or displacing out of the hip bones. So the big picture here is that the pectoral girdle is optimized for movement and flexibility, whereas the pelvic girdle is optimized for support. So now that we've covered the pelvic girdle, that is the hip bones and the sacrum, we're going to move on to talk about the bones of the lower limb, that is the leg. So each lower limb consists of about 30 bones. In the thigh, we have a single bone called the femur, which articulates within a deep socket in the coxal bones of the pelvis. And remember, that deep socket was called the acetabulum. The lower leg is composed of two bones, the tibia and fibula, which articulate proximally with the femur, and distal of the bones with the ankle, which are called the tarsal bones. Now, in between the tibia and fibula and the femur is a bone called the patella. The patella is a sesamoid bone which increases leverage of the quadriceps muscle and protects the knee joint. So just as we saw in the upper arm, we have a single very strong bone in the upper leg or thigh. The femur is this bone, and it articulates proximally with the hip and distally with the tibia and fibula. Now at the proximal end of the femur, we have a ball-shaped head which articulates tightly with the acetabulum of the hip to form a classic ball and socket joint. Now just like we saw in the humerus, the narrow region below the head of the femur is called the neck. And at the junction of the shaft and the neck, we see two large projections called the greater and lesser trochanters. These are important attachment sites for some of the gluteal muscles as well as the vastus lateralis, which is one of our thigh muscles. Inferior to this, about midway down the shaft of the femur, is the gluteal tuberosity. The gluteal tuberosity is the distal attachment or insertion site for our gluteus maximus muscle, which is used to extend and abduct the thigh and hip. Inferiorly, the gluteal tuberosity blends into the linea aspera, which is the site of attachment for the short head of our biceps femoris muscle, which is one of our hamstrings, as well as the adductor muscles. The adductor muscles help us to close our legs or bring them back to the midline of the body. Finally, at the distal end of the femur, we have the medial and lateral condyles. If you remember back to the last lecture, we said that condyles are rounded articular projections that are going to articulate or touch other bones. So both the lateral and medial condyle of the femur articulate with the tibia. In addition, the condyles are also origins for our gastrocnemius muscle, which is also known as our calf muscle. Between the two condyles is something called the intercondylar fossa, and to the sides are the medial and lateral epicondyles, which again are sites of muscle attachment. Finally, on the anterior surface of the femur, we can see the patellar surface, which articulates with the patella or kneecap. So just like the lower arm, the lower leg is composed of two bones, the tibia and fibula, which are united by an interosseous membrane. The tibia is the major weight-bearing bone of the two and articulates proximally with the femur and distally with the talus of the ankle. At the proximal end of the tibia, we have the concave medial and lateral condyles. These articulate with the convex condyles of the femur. And you should note this is the one time that we'll talk about a condyle as being a depression rather than a bump. Between the articular surfaces of the condyles of the tibia is something called the intercondylar eminence. The intercondylar eminence is a short projection between the condyles, and it prevents the condyles of the femur from sliding laterally over the condyles of the tibia. On the anterior side of the tibia, we can see the tibial tuberosity, which is the site of attachment for the patellar ligament. Below this is the anterior border of the tibia, otherwise known as the shin. The shin has a very small covering of muscle, and so if you bump it, it can be quite painful. The distal part of the tibia forms a concave articular surface with the talus, which is one of the bones of the ankle. It also forms the medial malleolus, which is that big bump on the inside of your ankle. Now let's go take a look at the fibula. The fibula, as I said earlier, is a very small bone. It doesn't bear much weight. At the proximal part, you can see the head of the fibula, which articulates with the tibia via the superior tibiofibular joint. Distally, we can see something called the lateral malleolus. So the lateral malleolus is the lateral bump on your ankle, and this is formed by the distal part of the fibula. So now we're going to move on and talk about the bones of the foot. Now, just like the hand, we have bones that make up the carpus, but instead of calling them carpus here, we call it the tarsus. And instead of having metacarpals, we have metatarsals, but we still have phalanges in the toes. So three sets of bones, the tarsals, the metatarsals, and the phalanges. So let's take a closer look at the bones of the ankle, otherwise known as the tarsus. Unfortunately, there's not a really good mnemonic to memorize the bone in the tarsus, but they tend to be a lot larger and easier to recognize. So the proximal most bone of the tarsus is called the talus. The talus has a nice rounded condyle that articulates with a concavity on the end of the tibia. Just distal to the tarsus, on the lateral side of the foot, we see a bone that's called the cuboid. To me, the cuboid is easy to remember because it's a nice cube-shaped bone, and it sits underneath the fifth digit or little toe. Now, lateral to the cuboid bone, we have something called the navicular bone. The navicular bone is a lot longer than any of the other bones you'll see in the tarsus, and so it's very easy to recognize. Now, resting atop of the navicular bone are the three cuneiform bones. Here, cuneiform means wing-shaped, and so the cuneiforms are named based on their location relative to the big toe. So the lateral cuneiform is the cuneiform that is furthest away from the big toe, whereas the medial cuneiform is the cuneiform that's closest to the big toe, or resting right underneath of it. And then in between those we have another cuneiform called the intermediate cuneiform. So just by knowing the positions of these three bones, you already know their names. And finally, the last bone, which I haven't mentioned yet, but is probably the most prominent bone in the foot, is called the calcaneus. The calcaneus makes up the ball or heel of the foot. So think about if you're going to stomp something, let's say some ants. You would stomp those ants with your calcaneus. The calcaneus is attached to the gastrocnemius or calf muscle via the calcaneal tendon, otherwise known as the Achilles tendon. So just like we saw in the hand, the bones in the sole of the foot are known as metatarsals instead of metacarpals. And we have 5 metatarsals. And remember, the first metatarsal is going to be under the big toe, second one is lateral to that, and finally the 5th one is going to be underneath the little toe. So just like we saw with the fingers of the hand, the toes of the foot are made up of phalanges. And there are 14 phalanges in total. So each of the little toes is made up of 3 phalanges, including a proximal, a middle, and a distal phalange, whereas the large toe, or hallux, is made up of only 2 phalanges. So this concludes our lecture on the appendicular skeleton. At the end of this lecture, there will be a few questions to test your knowledge of the material covered in lecture. As always, you won't be graded on these questions, but if you get less than 70%, I do suggest you go back and watch this lecture again and take detailed notes before going on to take this week's LaLima quiz. And finally, I'd like to point out that there are several very helpful apps for learning both skeletal anatomy and also muscular anatomy. And 2 of these include the Essential Skeleton 2 and also Anatomy and Physiology Revealed. So the Essential Skeleton 2 is a free app. It was brought to my attention by Carl Allen, who's another student in this class, and it allows you to look at different images of the bones, to rotate the bones, and also to save images of the bones and label them, which can be very helpful in taking notes. In addition, it's free, and so this is a really good app to look at if you're trying to be cheap and save money. On the other hand, if you're looking to invest a little bit of money, another really good app is Anatomy and Physiology Revealed. This is put out by McGraw-Hill, and it looks at the entire anatomy of the body using a real cadaver. And this cadaver has been dissected in layers so that you can pull off a layer of muscle, pull off a layer of bone, and look down deeper and deeper and deeper. It also lets you label images and save images. It will pronounce some of the different words for you, and it lists all the origins and insertions for all the muscles we're going to learn in the next couple weeks, so that can be really helpful too. At this time, I think Anatomy and Physiology Revealed is running around 40 or 50 bucks. It is kind of pricey, but if you're looking for a really useful study aid that is accurate, this is one that I'd recommend, and we're going to use it for probably both semesters. Now, if you don't have money to go buy it, I would suggest at least trying it out. We do have 2 copies that are at the library on reserve for you to check out. We also have copies available in lab as well.